Our moderator today is Dr. Mary Klingensmith. Dr. Klingensmith is the Chief of Accreditation for the ACGME and the Mary Culver Distinguished Professor Emeritus at Washington University in St. Louis. Previously, Dr. Klingensmith served as Vice Chair for Education and Surgery, the Residency Training Program, Director in General Surgery, and the Associate Director for the Woods Simulation Center at WashU in St. Louis. She was also the founding director of the Medical School's Academy of Educators. Dr. Klingensmith has served as a director for the American Board of Surgery and for the American Board of Thoracic Surgery. Additionally, she served in an employed position as vice president of the ABS, where she directed the EPA project for the ABS and led the Surgical Council on Resident Education. And currently, she represents the ACGME on the ACS ASA Blue Ribbon Commission 2 on surgical training. Dr. Klingensmith, thank you so much for being here with us today to moderate our webinar.
Thank you so much, Jenny, and good evening, everyone. Thanks so much for being here with us. I'm really excited to moderate this conversation today on surgical career paths and how to consider opportunities that might be outside of the more strictly defined specialty or practice setting. We have four amazing surgeons and leaders with us tonight, and I'm looking forward to hearing a lot more from them about their clinical practice and administrative roles. I'm going to introduce each of our four panelists, and then we have some questions that we've prepared that will sort of help us hear from the panelists in a wide-ranging way. But we do encourage you to think about questions and be dropping those in the Q&A feature on Zoom so that we can have some good discussion. We're planning to have about 30 minutes at the end to take your questions, so please do be thinking of those. I'd first like to introduce Dr. Rahila Essani. She's a board-certified colorectal surgeon, surgical innovator, and unapologetic force, as self-described, in the field that she is helping to redefine. She's a national leader in minimally invasive and robotic colorectal surgery. She practices at Advent Health in Florida and serves as co-chair for the No Scar Summit. She was born and raised in Pakistan. She trained in the US and built her career and continues to lead, all while raising her son as a single mother. She describes her philosophy as, quote, be a stiletto in a room full of flats, stand tall, make noise, and leave an impression. Dr. Quan Ly is professor of surgery in the Division of Surgical Oncology at the University of Nebraska and the vice chair of culture and advocacy there. Dr. Ly specializes in the upper GI and HPV cancers. She was born in Vietnam and migrated to the US when she was 9 years old. She credits her experience of leaving Vietnam on a small fishing boat and living on an island in Malaysia for 6 months without running water or electricity for making her resilient, adventurous, and optimistic. Dr. Vihas Patel is Chief of Acute Care Surgery, Surgical Quality Officer, and Vice Chair for Academic Affairs at Northwell Health Long Island Jewish Medical Center, and is an associate professor of surgery at Zucker School of Medicine at Hofstra Northwell. In addition to her clinical practice as an emergency general and critical care surgeon with robotic certification, she is prolific in surgical education. Dr. Patel transitioned from her role as the North Shore Long Island Jewish Residency Program Director to the inaugural Vice Chair for Academic Affairs in the Department of Surgery, now guiding the academic journeys of surgical faculty. And finally, Dr. Tiffany Sinclair is a breast and endocrine surgeon in private practice in San Diego. She has previously worked as a locum tenens acute care and trauma surgeon and as a general surgeon for Kaiser Permanente in Los Angeles. She completed her residency at Stanford and a fellowship in endocrine surgery at the Cleveland Clinic in Cleveland, Ohio. So those are our introductions, and I'm now going to start us off on some questions that we had prepared. And to get us started, I'd like to ask each of you to share in turn what motivated you to pursue the roles that you currently have outside of the operating room and outside of traditional clinical practice. Dr. Sinclair, would you like to go first?
Sure, thank you. So I think for me, some of it in terms of adding additional roles outside of my clinical practice is simply liking variety and not wanting to come to work and do the exact same thing every day. But I think more broadly, I like many of us in healthcare, feel compelled to sort of give back in a more broad way to fix some of the systemic problems that we all see. And I find that these alternative roles, whether it's in advocacy or administration, leadership, are the ways that are easiest for me to sort of fulfill that desire.
That's wonderful. Dr. Patel, your thoughts?
I'm inspired by what Dr. Sinclair said about giving back and advocacy. I think a big motivator for me has been I am defined by the operating room as a surgeon, but I don't want to be controlled by the operating room as a surgeon. And the only way I felt that I could turn the tables and be in control was to participate and sit at the table and lend my voice and opinion. And so a lot of the roles outside of the operating room and the clinical practice has been motivated by that seizing control over my life rather than being controlled by administrators and other people.
Yeah, I like that. Dr. Ly, can you share?
Yes. So, a few years back as a HPB, upper GI cancer surgeon, usually what I felt is by the time the patient get to me, it's often a lot further along. So I actually wanted to get to them before they need me. Because, so it's just that it's patient travel a long journey to get there. So I actually did a lot of my advocacy is with the community engagement. So we actually start working with the community to get them into screening. And so that's where a lot of my advocacy is working now is to work with the community and get more people into screening with the Black populations, the Hispanic and the Native Americans.
Wonderful. And Dr. Essani.
So I actually did a rectal cancer fellowship, which is beyond the colorectal fellowship. I was one of the few women in the country who did rectal cancer, and I started a rectal cancer program, the traditional approach. And then I started becoming more active on our Facebook group, Sages, and noticed a lot of men share their videos. Women never share anything, and we are scared of showing off what we do, what we are capable of. So I noticed that I started posting more. We started a women in robotic surgery group. So my action is more on social media, encouraging women to share more of their work. We are equal, if not better, than the rest of the world. So I'll share just one story that one of the groups in 2016, I posted a video of a laparoscopic intracorporeal anastomosis with transvaginal extraction, and they didn't know that the guys in the group didn't know that I was a female surgeon. So they thought, one of them said, "Oh my God, you're my bro." So it kind of, they all thought I was a male. So it's really highlighted for me that we as women don't share our work. And so it was important for me to start highlighting that we are actually probably better as surgeons, and encouraging the younger generation to share more videos and share our work and what we are capable of.
It's wonderful. I appreciate each of you sharing that. And I wonder if I can transition back to Dr. Ly and ask, what would you say are some common misconceptions about how an ideal surgical career path should look? Thoughts on how we should challenge what that ideal might be?
I think in talking to my female and male colleagues, it seems like the male colleagues, their ideal is to, be division chief, to be chairs and go that pathway. Whereas my female colleagues, they more into education, so they weren't interested in running the department per se. For me, I guess I find out that's the same way because I had the opportunity to be the division chief during COVID. And so for a year, the COVID year 2020, I was the division chief for our division. And I find that while I have the skills and the technique that I can run the division, I wasn't too crazy about organizing and like worrying about every single person. And I find that I am happier creating programs. So the ideal surgical career, for those of us who are in academic, we think about getting promoted, and then, after you get to professor, then usually like either you go toward the division chief, the chair, the deans, right? Or the other side would be the CEO, the CMO, in a leadership fashion. And I find myself, I'm not too crazy about either side, and I'm kind of like forging a path that is outside, and there isn't a name for it yet, but the needs is there for the patient and the community. So that's where I am right now.
Thank you for that. Anyone else want to talk about any sort of perceptions that they've had to themselves maybe challenge about what is an ideal path for a surgeon or surgical career?
I think when we're coming out as female surgeons, we all forget that some of us have children, and it is when I came out, I thought the ideal path is going to be just like I'm going to be an academic surgeon, division chief somewhere with my rectal cancer fellowship, and then the motherhood happened, and I deviated from there again, and then I was an academic for 5 years. My career just took a backseat to my child. Having a kid at home and being a mother as a surgeon, you still are, even if you have a supporting spouse, you're still a mother. So we forget that. And for a while, it took me a long time to reconcile with that. My career is not going to be the ideal I thought when I was coming out, that I'm going to be this big academic surgeon. And now I'm gone from academic to private, and I'm going to maybe go back to academic. And it's just, you kind of roll with the punches.
Yeah, so flexibility. Tiffany?
Yeah, I was going to say, I think Dr. Essani highlighted a good point, which is simply that depending on your stage of life, your life circumstances, your partner circumstances, your family, things change. There's what you thought your career would look like in residency, 5 years out, 10 years out. There's just no way to really know how things are going to be. And I think sort of accepting that and understanding that sometimes you have to change paths to accommodate the things that are going on to make yourself happier. Like Dr. Ly said, sometimes it's making a choice that's going to bring more joy to the career that you've developed for yourself. So there's never a wrong time to change. There's never it's not bad to have to evolve to make a new choice along the course of your career. So I think that's the best point that I can make there, is just that things are constantly changing, and that sometimes is good and it's always okay.
Well, I want to pivot to Dr. Patel, because our next question, I think, it sort of dovetails off of that. And in the introduction I provided with Dr. Patel, she's had some recent career transitions, it sounds like. So I wonder if you can tell us what you have perceived as the benefits of being, as you've been sort of exploring the changing roles and maybe even sort of non-traditional roles for a surgeon. You're now in this faculty development space. And can you tell us a little bit about that, or just generally how you considered that opportunity?
I reflect on what my colleagues have mentioned already about changing circumstances and versatility, and whether that changing circumstance is outside of the hospital practice setting, it's family, or it's the COVID pandemic, or other outside stressors. If you see opportunity and you maintain a growth mindset, it allows you to weather the storm of this landscape that keeps changing under our feet. And so, COVID was the thing that I think was the theme of my residency leadership role. And as we emerged out of COVID, I recognized I had changed, and our trainees had changed in terms of expectation for their training. And I thought it was important that we, at that point, give the trainees someone who was closer in generational experience for their leadership and share things that I could with colleagues who didn't have that same support and coaching. And so, as I transitioned, the same skill set of coaching and mentorship and sponsorship, I just transitioned to a different group of people that I think had shared experiences as me and who could benefit and I could benefit from as well. So it was very natural, but it was definitely accelerated by world stressors.
Yeah, thanks for that. There were many ways in which I'm sure all of us and our lived experiences, both in and out of the hospital, were shaped by COVID for sure. And I love that example. My next question, I'm going to direct first to Dr. Essani, but I'd love all of you to think how you might answer it. And I'm wondering, could you share a personal story or an example of a time when a maybe less than perfect fit turned out to be a surprisingly fulfilling opportunity on your career path?
So when I came out of fellowship, I took a position in Pittsburgh and the division imploded and I was left alone, pregnant, and yes, at a tertiary care center. And I started looking around for positions, and one of the places came up is a small city outside of Austin, Temple, Texas. And I thought my career path was taking me so far out in Texas. I was trained in the Northeast. My program director felt that I was going to be in the top 5% when coming out of the rectal cancer fellowship. And after a lot of thinking, I took the position, and it became the best decision of my life. I was able to build a big program over there, robotic surgery program, rectal cancer surgery program, and it launched me into being prominent in colorectal surgery because of where I went and made working at not a small institute, but a small, relatively unknown city. I would tell people I'm from Temple, and they would ask me Temple University, and I'd say no, Temple, Texas. It's 75 miles outside of Austin. So it became a perfect opportunity for me. Was I happy initially taking that position? No, because I thought I belonged at a bigger institute. But it's what you make with what you got. And, and you take your opportunity and you can make it work. And if you're unhappy, initially everybody's unhappy at a new place. We just have to give it time to let it settle out.
Thank you for that. Dr. Sinclair.
So similarly, when I graduated fellowship, I actually graduated during the pandemic, and it was very difficult to find a job during that time. I had colleagues whose contracts were rescinded. It was not a great time in general. And I ended up doing locums for a while. My husband got a job in San Diego, and I really wanted to relocate to California. We were in Ohio at the time. And a job came up at Kaiser. I am a fellowship trained endocrine surgeon, and I really wanted a job doing that. There was a surgical oncologist that was retiring at the time. She did a lot of endocrine and breast. And so they offered me the position with the caveat that I had to take on a lot of their breast volume. I had specifically not wanted to really do that when I was in training. It was not my favorite, but I felt like I had to have the, as I think Dr. Patel put it, the growth mindset. This was an opportunity for me to do the thing that I wanted to do to build my career. No, it wasn't perfect, but it was a stepping stone. So I took the job. I ended up really, really loving it. Actually, it's extreme, even though maybe the surgery is not my favorite, the care of the patients is so rewarding and fulfilling. It's one of my favorite things that I do. I built it up to 50% of my practice, took extra CME, did the best that I could to, even though I'm not fellowship trained in breast, to provide that level of care. That ultimately led me to getting my job in San Diego, which is what I wanted, to be with my husband. And now I'm building a breast center in an underserved area of Southwest Riverside County. So had I not said yes to that opportunity, I never would have gained the experience and knowledge that I needed to be able to get the position that I have now. So I would have never guessed this is where I would end up, but saying yes has led me to find something that I really love, and is now a really important part of my career.
Well, that's a great story. Dr. Lee, do you have an example from your career?
Mine's probably a little bit of a difference in that I got so when all the diversity, equity, inclusions was coming about, so I was asked to be the associate director for DEI for our cancer center, and and taking on that role, I guess it gave me opportunity to look at a different level, and it turned out that um, what I wanted to do and what the position was asking of me was not quite the same thing. And I try very hard to do it, but um, I just learned that I would have to be so stressed out doing exactly what the administrations would have want to do and what I personally would make me happy spending my time, and it was the hardest decision to make a break, right? So I basically stepped down from the position just because I didn't think I could fulfill what they wanted, um, and I wasn't happy doing it. I was just stressing out. In stepping back, I can focus on the stuff that I like. I like the community engagement. I like the program directing. I did not want to do the administration side of things. So that also taught me what I needed to do to make me happy. And I think once I stepped down, I slept better. I was happier. It was a 180-degree change. So like I um was happy with the opportunity. It was helpful to know that what's available out there, but also we need to keep in mind that we can also walk away.
I love that. And that's a really important reminder that it's okay to say no, essentially, right? Over time, to say no to things. Because I don't think we always, especially as women, we don't always do that well. And it sounds like you also were sort of setting some boundaries and just saying, this is what I love to do, and I need to create space for that stuff. So that's a great story too. And Dr. Patel, do you have anything you could share with us about your less than perfect opportunity and how that worked out for you?
Um, yeah, I do. I have a couple of them, but I think the most recent one was being asked by my chairman to do more in the quality sphere. And I thought, oh my goodness, the only people I saw in my department who were doing surgical quality were, the senior faculty ready to retire, kind of put out into quality pasture. And I had to overcome my own biases, thinking, oh, I'm moving farther and farther away from being in the operating room and sitting at some desk judging my colleagues. But the more that I did the quality reviews, I had an opportunity to interact with so many people outside of my department. It increased my network. It increased my knowledge. Like Dr. Sinclair, I did CME, I did a fellowship in quality, and then more importantly, I joined the American College of Surgeons Quality Task Force. It just completely opened an entire new world of people outside of local politics who care about just improving patient care. And the lesson here was, I had a bias, and it was a negative bias, and keeping myself humble and open allowed me really to pivot to something that is incredibly fulfilling and still keeps me very close to patient care.
I think that your story, Dr. Patel, has some echoes of Dr. Sinclair's, where your career kind of took you in this direction you had not anticipated, but you leaned into it and you learned a lot and made the most of it. Really important lessons for sure. I'm going to pivot, and I want to go back to Dr. Lee. And the question I have for you is, what roles would you say that mentorship has played for you in navigating some of these unexpected career turns?
Um, so I have a very eclectic mentors. So I when I started out my career, I was half clinician, half researcher, and all of my researchers um, mentorship were PhD, so they're non-clinician, and they taught me to think out of the box, think differently from a clinical side of things. And it's like, and I didn't have a single mentor throughout the year. I have multiple throughout, and I think it's helpful to find people and just talk to people. So like everyone in a way is my mentor, from my colleagues to my chair, my division chief. So each one gave me a different perspective in how to look at life. And so I think, don't be afraid to just talk to people and just bounce ideas off of others.
Great, thank you. Dr. Essani, how can surgeons maintain motivation and professional satisfaction when their career path deviates from their original plan?
So I'll give you a little bit more story behind my career. I moved from Pakistan. When I arrived here, I had taken my USMLEs. I couldn't. I did a couple of years of volunteer research trip, and I sold sunglasses on the weekend to pay for the rent. And then I was in prelim, spent another few years in research, applied late for colorectal and didn't match. Instead of taking a program I didn't want, I actually didn't rank some of the programs because I applied late in the year. I ended up doing a simulation research, and now my background is in simulation research, and I'm working with robotics companies developing simulation programs. Then I decided that I'm not going to apply for colorectal. I'm just going to do rectal cancer fellowship because that's what I wanted to do. When I was coming out, women in colorectal surgery were being slotted into pelvic floor, and that's what I didn't want. So I wanted to do rectal cancers. And that was the best decision of my life, to deviate and do an extra fellowship, because my mentor taught me to be innovative. That led to then from that year, I matched into a fellowship in colorectal. That was the last on my list. I never envisioned myself that I was going to match that program, because there were 18 programs above that I didn't match into. And from there led on to, doing rectal cancer, robotic surgery, and innovation. Now I chair National Orifice Consortium because I started doing national orifice extractions. I'm looking at doing surgeries through national orifice, transvaginal colectomies. I'm kind of working on my IDE on that. So none of it was ideal. I never thought I was going to go from A to B to C. I ended up going from A to C to D to Z and back to A. And it worked out for me. I mean, and this is why my motto is don't be a flat in a be a stiletto in a room full of flats. You have to stand out and be proud of what you've done. I mean, there were times when my whole training took me 13 years. People would ask me, are you ever going to get a real job? And, do we all want to train this much? No, but it has brought me where I am, that I can do international talks and develop new procedures. I'm kind of hoping to name this procedure after my name. So you just have to kind of roll with it.
Thank you so much. That's a great, inspiring story. So good for folks who are listening to maybe pick up some things. I'm going to circle back to Dr. Patel, and we're going to go back to a question that might be helpful to some of the more early career surgeons listening in tonight. And I'm wondering how you would advise an early career surgeon in how to assess whether a practice or a practice setting aligns with their long-term goals and values.
It, I think it's a very hard question to answer, because it's hard to have a fixed goal. I think it's important to, as an early career surgeon, to accept that things are going to change. You yourself are going to change. What you desire in your practice will change according to, as we mentioned, how your life evolves. And for the early career surgeon, I would just reflect back to myself and say, I sought a practice environment that would support me continuing to grow as a surgeon, and with that improved medical judgment and confidence, the confidence that I could change my practice setting if my goals evolved and changed from where I was. So it would be a bit of reassurance advice to the early career surgeon that if your practice doesn't meet what your goals are now or later, change your practice. It's totally okay. It's totally okay, and it's going to be okay.
It's great advice. Thank you. I have kind of a round robin question for all of you, and I just wonder if we can sort of do a pivot and just ask you in an open-ended way, what are some of the pros and cons of either where you are now or some of the decisions you've made along the way? I'm trying to figure out ways we can kind of surface some other wisdom that you have for the audience tonight. Who would like to go first with either sort of a pro or a con as you now reflect on your path or even where you are currently? Thoughts that you might be able to offer anyone?
When I had my baby, he's 12 now. When he was born, in the first few years of his life, I stopped being active on the national level or anywhere. I focused on the motherhood. I also felt that my career was going to just die over there because as a mother, I just, I could just do so much. But I would never, never exchange those years ever for anything else. If I was given a choice, I would never do it again because that time I spent with him and my career still waited for me. I felt that it was not going to wait for me, but it waited for me. I started doing robotic surgery. I did all of that afterwards, after the prime years of the younger years of his life when I was there for him, and I would never exchange those years for anything else. So those are my pros and cons, both ways that they were going through in my head. I'm thinking like, oh my God, motherhood is going to kill my career, but it didn't.
That's great. Thank you. Anyone else have something they'd like to offer?
I guess I will just say on that note, obviously this is not what this seminar is about, but I spent all of my time trying to build my career. I decided not to have children in residency or fellowship. And now on the other end of it, my husband and I are going through infertility issues, so on and so forth. And so, thinking about the pros and cons and trying to figure out what you want your career to look like, where you want things to go, those are all super important considerations. And you can never know what you will regret until it happens. But I do think bringing those topics up and just emphasizing, especially for women going through training these days, that that's something to think about. There's not a right or wrong, good or bad, but just, something that for us as women surgeons who spend up to 13 years or more going through training, that can make motherhood and family building something of a challenge and something to kind of think about how to incorporate in your life if that's something that you want.
I
Well,
would
that's
add to that.
totally grateful that you brought that up because I think that is really important that we do mention that. Important to
I would
say. I'm
add to
sorry,
that.
Dr. Go ahead.
I heard from somewhere or somebody, it's never a good time to have a kid. I did the same thing. I didn't have my child during residency or training and waited 13 years. But even if I had a baby during residency, it would have been hard. But baby during early careerhood was hard too. I mean, it's never a good time. So everybody should do what's best for them, you know, not wait or wait. It should be a personal choice.
Dr. Lee or Dr. Patel, any pro-con reflections you might offer?
Dr. Patel, you want to go first?
Thank you, Dr. Lee. I wanted to, again, a little bit off topic, but what has helped me have a fulfilling surgical career has been accepting that I would need to pay for resources to help me. And I wanted to share that with this group, this audience, that I paid for help to take care of my children so I could be in the office. I paid for coaches to help me through my office career, so I could be there for my children. And I don't think that anyone ever earlier in my education emphasized that I can control my life if I pay for other people to help me. And I know that's painful to say, but boy, it was really very liberating, and I would share that experience with the audience here.
No, that's great. I mean, there is no reason why you cannot pay someone else to do the things that, so you can focus on the other stuff, like the things that you are trained for. Um, for myself, I don't have children. I guess for me going through training, I did not want to have a child without a strong marriage and a partner. And so since I didn't have one or didn't find one that I was comfortable or strongly felt, so I didn't want to bring a child into that situation. And so it turned out, I don't have kids and I don't regret it. I didn't want to force the situations. I decide to accept life as it is. If I find someone that I'm happy with, then and if the children's gonna come, then we'll deal with it. If we don't, if it wasn't meant to be, then it's okay. And I just, focus on the things that I can change and the things that I can work on and be happy with what I have. Um, and and in that way, you will be happy because happiness is a choice. We choose to be happy and everything else will fit in. Um, you know, your life will evolve around that. And that's what I want the audience to feel like. Choose to be happy, choose to know what would make you happy because happiness is inside. You cannot get happy thinking that someone else doing something will make you happy because that would never happen.
Yeah, this is excellent advice from all of you. Thank you for that. I think we're going to pivot and move to the Q&A. We've received some questions from the box. And I'm going to just throw these out, and whichever of you panelists have something to say, that would be great. So the first question in our queue is from a mid-career surgeon, and this is someone who is, it sounds like, being forced to move into a different career pathway. This individual describes having worked for greater than a decade in one field, but due to some local geographic forces, is having to choose a different specialty. This person describes herself as having been given a second chance to retrain. And she's just wondering if you have advice on how to break through some of these expectations or sort of glass walls for her as a mid-career person who's having to make a pivot.
I would say, if the advice is being given, hopefully the advisor is there to support the transition in the path. So, I would look at this as an opportunity that's guided and to look for guidance. And it doesn't have to be necessarily, a 180, different career. It could be melding of your previous skills and interests, and keeping some of those core things in this new phase rather than new career path. And maybe it's just a little bit of game playing in your mind, but seek the support from the people who are giving you this advice, and don't stray far from what your talents are.
Yeah, Dr. Patel, thanks for that. I think that's excellent advice. The next question that's in the submitted queue, and I'll encourage the audience to keep submitting questions. They're super helpful to us. This is from a surgeon who describes herself as someone who started out late and is now a senior surgeon, and that she is learning to sort of readjust her role. And the question is, what are your feelings on, quote, hanging up the scalpel? But then still remain impactful in your specialty. She references that we've had some discussion about staying a mentor to those who follow, but what is your advice to this person who is considering sort of that next phase? How to stay relevant and stay impactful?
I think there's a lot of things you can do, by hanging up the scalpel doesn't mean you have to continue practicing, but there's industry you can impact with industry. I think our societies kind of tell us that you should not partner with industry, but the only way to be impactful with industry is to partner with them and make a change from within. That's one aspect of a role, somebody who wants to hang up. And mentorship, obviously, there are lots of women surgeons who are out there who need mentorship. So being active through AWS or through their own personal society, their own specialty society is a great option too. But industry is one of the great options to stay relevant as well.
Dr. Ly?
Um, I thought about it. It's like as we getting older, and there probably a time when I may not want to be the primary physician. But you can still be the first assistant to the younger group and help them build the confidence in their surgical career, and that might not be a bad idea. Just going and working with the junior faculties or the younger faculty and be their assistants and when their first year out.
Thank you. This next question is for those of you who are perhaps either currently in or formerly in an academic environment, and it regards academic promotion. So this individual says that she feels confident and that others have told her that she's ready for promotion now from assistant to associate professor. But when she spoke with her mentor, she was told that she should not go up for promotion with only an adequate portfolio, but that it really should be a spectacular portfolio, and that more doors will be open if she waits and goes up later when her portfolio is more spectacular. Do you have advice for this individual? Go now or wait?
I applied for assistant to associate within 3 years or 4 years of being at Baylor Scott & White, and the associate dean did go through my portfolio and said maybe I'm not ready. And I, like it is could be surprising for herself too to find out how much things she's doing. I would advocate to kind of look through everything. How many talks, a lot of things count. It's not just small, like it's not just like a paper you've written, a lot of things you could do on national, international, and even school level. So it's never a good idea to have somebody else take a look at your portfolio and another set of eyes. It's not just a mentor. If I had listened to the associate dean who told me I shouldn't go up for promotion, I wouldn't have gotten the promotion. I did, and then I was up for professorship too right after, like 4 years after that. So I wouldn't recommend just hanging the hat by one person's advice.
Good thoughts, others?
I think it's important to distinguish what a mentor does for you and what an advisor or a career coach might tell you. And so if your mentor is giving you some advice, look at that relationship through their lens and understand, what might be motivating them to kind of hold you back. And I think that Dr. Essani's advice is great. Seek out other people to give an objective review of your qualifications. And you might discover that, the vast majority agree or disagree and feel that you are ready for promotion. So don't let one person be your yardstick.
Thanks. Thank you both for that. Hopefully that helps that person a lot. Okay, this is a really good question. Do you see pivoting as a kind of loss and that you've lost to those who have doubted you or tried to block your path? Or do you see it more as a personal evolution toward becoming who you're meant to be? Dr. Sinclair, do you want to take that one?
Sure. I think it's both. I thought I was going to be an academic surgeon. I trained at powerhouse academic institutions for all phases of my career. That's where I envisioned why I would be. I do think in some ways it's loss for the kind of educator I could have been in that setting. I love teaching. I think I'm really good at it. And I think I would have benefited a lot of trainees and students had I taken that path. That said, maybe I would have been less happy than I am now. And I discovered a equally, if not more, fulfilling part of my career that I absolutely had no idea even existed when I envisioned that as my future. So I think it's, yes, a loss in some ways, but also 100% a personal evolution towards something that I'm really, really happy about. So both.
Great story. And I think, sometimes we have to be a little farther along before we can understand that those feelings of loss were temporary and that the gain, I think especially Dr. Sinclair, your story is very inspiring to someone who is feeling discouraged. You described, graduating during the pandemic, not really having a job. The feelings you must have endured then, it must have been really hard. But seeing the joy on your face and describing that you're starting this whole new breast health center is amazing. So yeah, perseverance and persistence pay.
I think
Okay,
I
go
think
ahead.
it's also important to remember that we all continue to evolve. We're not the same people we were when we went to med school, when we started residency and ended residency, and we're going to continue changing. Just like in a marriage, people change all the time. You met somebody, you married, and now you're two different people. It's the same thing, and we are evolving continuously as well. So I wouldn't look at it as a loss. I would look at it just a natural evolution of you as a surgeon.
Yeah. I mean, it's difficult not to feel it's a loss because that was your ideal, that was the path that you kind of envision yourself. But like Dr. Essani said, we will have to change because as we get older, and the change may not be a bad idea. And so just sometimes, we hate change, but embrace it because it might give you a better future.
Okay, another question from the chat. How do you navigate differences in institutional culture or regional practice? And what external factor has most influenced your success?
Um,
Dr. Lee.
so institutional cultures. So I did all of my training on the East Coast. So I was somewhat influenced by like the idea of what is norm. And I went into the Midwest, and ultimately it fit my personality better and my cultural background a little better being in the Midwest. But the training of the East Coast mentality of, like it's still there. And sometimes when things happen, and I was like, well, yeah, that's acceptable. Like when I first came, one of the residents was being was deemed to be very aggressive by the faculty, and I was like, but that's accepted norm in the Northeast. I mean, like that's what they would tell me that I was supposed to be, and you're telling me that he's wrong, and so like I have to change the mindset of what is accepted here, what is accepted there. um and so, part of the things is we just have to step back and see what the institutional culture is. And then also from your own self, what is acceptable for you, right? And you have to be happy. And if that fit with your personality and what you think it is, then this might be the right environment for you. Um, just because, so if you're not happy with the way things are, things may not work out in the long run.
Good thoughts. Here's another good question. This individual describes currently being in a happy place, but has come through what sounds like some difficult change from a toxic environment, but now is in a good place and made some changes, but finds herself over justifying the current position where she's happy and shying away from sharing a lot about her position in department meetings. Do you have any advice for her as to how she can overcome this challenge?
I used to be in that position sometimes. I was told I was aggressive sometimes, and then I remember one of the trauma surgeons told me that I was really good at advocating for myself. I think we as women are, we shy away from getting attention to ourselves. There is no such thing as bad attention. You just have to be very confident in yourself. It's hard initially. When he said it to me, I was hurt. This was a robotic committee meeting. I was trying to advocate for everybody else to use a robot, and his answer to me was that I am very good at advocating for myself. And we have to take that with a grain of salt and think of where they're coming from, and continue just working for, the kind of work you do, and your work will speak for itself.
Great. All right, I'm happy to say we have a question from a medical student. Medical student is struggling to determine what specialty she's most drawn to. Can each of you share how you determined your surgical career specialty? Whether, Dr. Sinclair, it was a pivot or not? You want to start, Dr. Sinclair? How did you choose the specialty from which you have done a pivot?
Well, I still do 50% endocrine surgery, and that's
Okay,
what
fair,
my fellowship is. So I feel like I can speak to that because I still really, really love that, and that's a huge part of my career as well. I think it was two things. I like a little bit more technical surgeries. Neck anatomy is really beautiful. It requires a lot of care around the nerves, and I enjoy that. I will also say I really didn't want to be on call. I like to work during the day and sleep at night, and endocrine and breast actually are both a little bit more lifestyle specialties where, yes, I certainly can have emergencies, but for the most part, it's more Monday through Friday with or not business, but surgery hours. So I am much happier with this schedule than I was when I was at Kaiser and having to take general surgery call, 24-hour call, etc. So that was a important factor in helping me choose my specialty.
Who else has advice from our medical student?
I'll go. I picked colorectal because my mentor, when I met him as an intern, he was the nicest guy. And I was like, wow, colorectal surgeons are the nicest people around, because I work with some thoracic surgeons. And that was one. And then two, colon is so forgiving. If it falls apart, you cut some more, and then you put it together. There's so much of colon. And the third point is that I hate operating in the middle of the night. I could not wake up for an appendectomy or anything. And colorectal surgeons actually have great quality of life in terms of we take call, but only for our patients, that's one. And two, we do so many other things. We have longitudinal care for our patients. So we see patients over 5 years when we're doing cancers. We do a day of anorectal, a day of scopes and the clinic. So it's really a mixed bag. And my advice would be to pick a career, what speaks to you, what you like, because it's going to be for life.
Yeah. I would say the same. I love surgery. I love I went through a different path, different thoughts, right? I originally want to be a plastic surgeon because I like the dexterity and the reconstructions, but then I find out it's too superficial for me. I like the gut. I like the liver, the pancreas. And so that was more my thing. That's where I'm happiest operating. And so I choose surgical oncology because my life is more controlled. It's like everything is elective. Everything, it's like very minimal things or emergency. I don't mind getting up in the middle of the night, but I'd rather not do that every night or every other week. So surgical oncology was more my style, and I'm happy with what I chose.
Dr. Patel.
I think I'll end this with a note of confusion for our medical student, because you've heard 3 different specialties and all about what a great quality of life. And I'm going to say my specialty, which started out as trauma and now emergency general surgery, is also conducive to a great quality of life, because when my pager is off, my pager is off. And I can hand off my patients to my colleagues, because the patient didn't come to me, but they came to the hospital. So I think all of them are conducive to great quality of life if you control your practice setting. But I chose trauma and critical care because I was afraid of those types of cases and I wanted to overcome my fear. And that, I think it's however you approach it. But the practice setting and the practice type can all be conducive to a balanced life and surgical career.
I guess it's just identifying your own personal pain points. What is painful for me versus Dr. Patel versus Dr. Lee, it's all going to be different. So thinking about the things that are important to you, the things that you like, I think are the most important. And those are going to be very different for everybody.
All right, I think this maybe will be our last question from the Q&A. And the question reads, has anyone encountered discrimination in the workplace? As a mid-career surgeon, this person says that she's being stripped from leadership roles and discouraged from applying for promotion by an administrator after an administrative takeover. And she's curious as to your experiences with discrimination. Any advice you could offer this individual?
I wouldn't say, clearly discrimination, but I didn't feel like where I was in Texas that I was going to get where I wanted to be and what my career trajectory. And I reached my career ceiling and I was unhappy. And I think it was time to change. And you never know what's out there, although grass is not always greener on the other side, but you wouldn't know until you try. So if you're unhappy in a place, maybe it's time to explore others, and especially if you're being discouraged from leadership opportunities and being stripped, then maybe this is not the place for you, and these are not your people, and it's time to move on to a place where they will celebrate you for who you are.
Other thoughts on managing discrimination?
I think it's important to have some humility and try and figure out, what are fixed things that cannot be changed about you and what are things that might be able to be changed about you. And I would plug for a coach, someone outside who could help you assess, is this a case of discrimination or is this something else? And don't take control over the situation. And I think that's really, really important. Be in control.
Excellent advice. Well, we've just about reached the end of our hour. I want to thank Dr. Essani, Dr. Lee, Dr. Sinclair, and Dr. Patel very much for sharing your wisdom and experiences with the audience today. I've enjoyed getting to know each of you a bit better through this process, and I look forward to seeing you in person sometime soon. I want to thank all of our attendees for joining us today as well. And reminder that a recording of the session will be available soon on the ACS YouTube channel. And just a quick note that we invite you to join the ACS Women in Surgery Committee on October 23rd from 3:30 to 4:30 Central Time for the next webinar, which is titled, When Things Go Wrong, Who Can I Talk to? Support After an Adverse Event. A great topic, something we don't talk about enough. And there will be more information coming out soon from the Women in Surgery Committee on the FACS.org website. So with that, big thanks to you panelists. Thanks to all of you attendees. Enjoy the waning days of summer wherever you are, and good night.